to start the session today. So good morning, good afternoon, good evening, everyone, depending on where you're joining us from. Today is our 9th daily lightning session, and it's the 11th of August, 2020. Over the past few weeks, we have been together going through, listening to people share actions that are taking, that are carrying out on the field to address the major challenges that are facing in terms of offering immunization service delivery in their context because of the COVID-19 pandemic that is plaguing the globe right now. And so as you're joining in, we'd just like to invite you once again to share to share with us your country and your city in the chat so that we'll know where you're joining from. And while you're typing, please ensure that your message is addressed to all panelists and attendees, so that everyone in the room will see what you're typing and not just Francois, Shalini, and myself. That said, I'd like to say good evening to Francois and Shalini.
Good evening, Charlotte, and good evening to everyone who is present for the time being. More will come, but happy to be there and to listen to that session.
Thank you, Francois. And over to you, Shalini. Evening. I know it's really late. It's quite late at night over there in India. So how are you doing?
Great. Thank you so much, Charlotte. Good evening, everybody. It's great to be here as always. And I am anxiously waiting to listen to all the scholars and François and you. So, hi.
All right. Thank you, Shalini. Okay. At the same time, I say good evening to Hassan Saleh from Yobe State in Nigeria. Mercy Onu Peters from Nigeria, I think from Abuja. And we have Josephine from Kenya. Great to have you here. And Temenka from Limpopo province in South Africa. Yeah, that's so great to know that South Africa is in the house this evening. So as I said earlier, I shared the link to this session in the chat. So if you could just share them in your country groups to remind your mates, our fellow scholars that the daily lightning session is ongoing. So we have a Q&A section. It's not for messages, it's not for greetings, it's for questions. So you have any questions, you want enlightenment, please you click on the Q&A icon and you type in your question. I will be delighted to provide answers to those as long as it's possible. All right, so now, where are we as far as exercise 1 of the COVID-19 Peer Hub is concerned? We are in exercise 1, week 1. The past 2 weeks were in the IDS engine, that's over. So now it's exercise 1, week 1, running from August 10th to the 14th. So what do we have to do? We have to analyze our challenge and drive and draft action steps to address those. So yesterday, for those who attended the Global Assembly, the COVID Peer Hub Global Assembly, you saw the guidance, the directives that were given to you by REDA, and you also received those in your mail. And if you have been able to visit the learning.foundation platform, I do hope you have done so. You will see that all the step-by-step instructions are there for you that will guide you to be able to carry out these tasks without any problems. But if you do have some problem, no worries, we are here for you. The technical support session with Alain Blaise Tatinku every Tuesday to Friday at 11 a.m. Geneva time. That's where you go to post your problem that have to do with navigating the various platforms or any other technical issues that you may be facing. And then we have these daily lightning sessions from Tuesday to Friday in which you can come to talk about, to listen to and get us talk about the various actions, that is the content of your project. So right now I'm going to share on the link, some links with you to the if you have not yet downloaded the template for the project and the rubric, I'm sharing the links right now on the chat so that you could direct links that will enable you to download these very useful, ultra useful documents. All right, so I'll just put up this slide and then I'll invite Dr. Francois Gaz just to comment on what is actually expected of scholars. What is the end result of the exercise 1 of the Peer Hub? Over to you, Francois.
Thank you, Charlotte. I think, in simple terms, when you have applied to be on that exercise, we expect at the end of the 4 weeks that you present a little project. You know, in the business world, they would call it a little business plan. It means you will have to define the challenge you decided among the many challenges that you are asked to address with many activities. You will be asked to choose each one challenge, which of course will mean that you will have, wherever you are, at what level you are, from health center to national level, you will have, according to your responsibility, choose one challenge over the many challenges you have to address to reduce the problems, the overall problem you have with COVID, which means less attendance of mothers to immunization session. But of course, there are many challenges to resolve in order to make those women come back to the health facility to immunize their kids. But you will be asked to choose one particular challenge that you consider a priority one and something you can do. So you will basically go up, sorry. You will basically try to develop this short, practical, justified little action plan with idea to resolve the problem that you face, to contribute to the problem. So basically, we don't expect you to make a separate project from what you are already asked to do at every level based on the plan of action for the continuity of immunization, but to choose maybe one area where, if you focus and you are very concrete and you can follow up in that area, if you follow the steps that will be provided by the current course, you will be able to do well. But we are not asking you to make a separate plan from, you know, you have an overall plan and you can choose one part which may be well or not well defined and focus on it based on your local context. But of course, the overall idea behind this exercise is to restore immunization services. And to restore immunization services, there are very concrete steps. You choose a challenge, you understand the cause of the challenge, the principal cause, we call it the root cause, and then you have actions which are like solutions that you're going to implement to get the contribution to your overall problem. I think it's going to be extremely important to be very specific, very concise, and be realistic in what you do. And you need to be sure that whoever listens to you is able to understand what was your challenge, why did you choose this priority challenge in your context, how you're going to implement your solution, because any solution required few steps that you need to implement your main ideas to resolve the situation. And you will have to explain very well how you do that. So this is the main, I think I would like to focus on one thing that may have not been always very clear, is that we all know your overall challenge, the return of mothers to the level of coverage that was before COVID. Now, when COVID impacted on your program, what happened? Coverage went down, dropout went down. Now this is a sub-challenge. That's the cause of the overall challenge of the drop of the coverage. Now you have to understand why, and if you understand the why, you may identify really how you're going to fix that problem or part of the problem. It's only addressing all the issues that the challenge that you may have the perfect and return to the level, but you can contribute at your level where you are to do better. So let's make sure that we're going to really understand the challenge you selected among your many challenges and what were the cause, why you choose that challenge, and how you're going to develop, briefly for the time being, solution for that challenge. So over to you, Charles.
Thank you very much, Francois. And that said, here is the list of 7 challenges that were identified based on the responses from a survey from WHO and also from the application forms that you all filled. So there are 7 in total. And just to say, if your challenge has not been identified here, it doesn't mean you do not belong here. It just means that you can still spell out that challenge when you're writing out your template. So this list is not exhaustive. This is just the list of the most prominent one that came up very often. So right now, I'm just going to invite you to raise your hand.
Sorry, can I interfere here?
Yes, please.
When you look at those challenges, you know, they are written almost like operational objective. Let's look at the first one: respond effectively to outbreaks of vaccine preventable disease. This means that outbreaks are coming in, but they are not getting detected, or you're not doing much to try to respond to the outbreak detected. So the response is become an operational challenge, but to do that, to respond effectively, you need to list what are those actions you need to do to respond effectively, and are they challenging, and what you're going to do about it. Just a little example. Thank you.
All right, thank you very much, Francois. That's very important. So right now, it's time for you to talk. We've been talking for like 11 minutes, and it's just a 30-minute session. We do prefer it when you do the talking, because you are the one on the field. You're the one at the forefront. So you're the main actors, and you should be the main focus of our sessions. So now I've already seen a raised hand. Promise Onaibe, please, you unmute yourself, and when you speak, you first of all tell us where you are calling in from and your level in the immunization system before you go ahead to answer the questions. Over to you, Promise.
Yeah, I'm Mr. Promise Onaibe from Delta State, Nigeria. I'm an immunization staff. My question is that these very challenges that you highlighted here, are we going to pick out of date, or are we choosing our challenge that is related to this? Hello, can you hear me?
Yes, I got you. I thought you wanted to answer the 3 questions that are pasted on the screen right now, but no problem. So I'm just going to invite Francois Gaz to answer that question. You want to find out if your challenge should be chosen among these 7, or it should be what you are actually facing on the field. Am I right?
Yes.
All right, Francois.
You are free. You know, the list of the 7 challenges are interdependent, and they all contribute to a drop in coverage. But each of those challenges carry a different weight based on where you are. Now, if among those strategic challenges, yours is not there, you will explain what is your challenge, why you choose it, and what will be, if you resolve the challenge, what do you expect the challenge to, if you resolve it, to change in the situation. So you are free to take it out of the 7 listed here, but you will have to explain why and justify it, and having some element. Thank you.
All right, thank you very much, Francois. Promise, I just want to find out from you, is that answer satisfactory? And if yes, I would really like to invite you to...
I'm okay with that.
Okay, so can you tell us about your challenge? Can you attempt to answer these questions?
What is priority challenge? My priority challenge is distribution of vaccines along the riverline area. It has been a very difficult challenge to us to cover the riverline area, both immunization activity, during session, and all.
So why, yes, we are getting you. So why is it important? Is it because of, how is it related to COVID-19? Unfortunately, we can no longer hear you. So if you are in the room and you want to...
Yeah, it is back.
Promise, we lost you for almost 30 seconds. So if you're getting me, can you share with us what you are saying again, if you can hear me? Unfortunately, we can't get Promise, so I do hope we'll be able to get him back before the end of the session. So I'm going to, I see another hand raised, Yusuf El Mohamud. So I'll ask you, Yusuf, to unmute yourself if it's possible, and then you have the floor.
Yes, good evening, or good afternoon, good morning, all of you.
Yeah, good evening to
And
you, Yusuf.
yes, my name is Yusuf Ilmi. I am a national SIO coordinator in Somalia. I'm from Somalia. I work WHO. I am national SIO coordinator for Somalia, and my challenges that I am just face like to focus is ensuring health workers and safety while delivering and vaccine because we are resuming an SIS campaigns for Somalia, which we have postponed for along 6 months due to the COVID-19. Can you hear me?
Yes, we are getting you.
So my challenge is how we can deliver in this vaccine or how we can reach all the children while health workers are safe. Say our specific goal is to implement it and not harm and campaigns. Yeah, to implement a campaign while our health staff like vaccinators and all health staffs are safe and to reach our target goal. Yeah, can you hear me?
Yes.
So I have enlisted three main actions that I am I'm thinking if we implement it, it's supposed to be and overcome our challenges and to train all the vaccinated teams. Those are doing house activities, how to for preventive measures, how to keep safe themselves from the getting and this pandemic disease COVID-19, and how they can save the parents or children. Like example, the number one and number two is to deliver or supply them like face masks and service and sanitizers. And the third action was to conduct and supportive supervision, how they are implementing these and preventive measures. Over to you.
All right, so thank you very much, Yusuf El Mahmoud, for sharing your experience with us and talking about specific actions. Francois, I have a feeling that, like you said, most of those challenges are interrelated. I have the impression that there is some interrelation in challenges here. What do you think?
Absolutely.
And
And I think you mean who should answer?
Anyway, I was hoping. I just also wanted to invite you, if you have listened to Yusuf's
Yeah.
experience and you have any comments or questions, please do type them in the chat, or you raise your hand if you want to ask a question. But my question was actually addressed to you, Francois. That I
Okay.
see it's like there's an
I think
interrelation of.
I think you have described very well. Enfin, your challenge is very clear for you. The objective of your challenge is to ensure safety of vaccinators and recipient mother when you do your campaign. This is now this, but if you want a goal that you need to be, you will have to be maybe a bit more specified. What do you mean when they're safe? Because you can distribute masks and maybe they don't wear them, etc. But you have a space. I would love to hear the specificity of what you want to achieve. You know, it's like a sub-objective that you will say, yes, my vaccinators were safe. You know, you have presented supportive supervision that help you monitor the implementation. You have you have mentioned that you're going to deliver all the equipment to all your vaccinators. So I would like you to be a bit more specific on your objective, quantified objective. What do you mean by ensuring safe? This is a wishful thinking, but are you going to be able to measure it? What kind of objectives you want to achieve in the safetiness?
Yusuf, can you just answer the question?
I got him in what measure and that you are means we know that we are using more vaccinators. Those are doing house to house during the campaign. So our goal is to achieve to implement our campaign in a safe way while we are keeping not to spread this COVID-19 or while our vaccinators are healthy. We are not getting
Okay.
this
Can you be,
COVID-19.
can you be even, it's an objective, you know, in one way, if you have an objective, you need to quantify it. When will you say, I have made it? Will you say I've made it when 80% of your vaccinators, even the new one that you recruited and the old one, are wearing masks? When will you say we did it safely? If someone say, how safe were you? Can you answer it was safe, or you will say, what proportion of vaccinators were safe? It's an example.
Yeah. We mean
What means safe? What describe what mean being safe and what proportion you expect to achieve at the end?
we mean 100% of our facilities to be safe during their and in house to house visit. I mean that, yeah.
Which you mean, if I understood well, that 100% of those vaccinators will be wearing masks as well as the mothers they immunize house by house. Am I correct?
But mothers are not wearing the mask. Those wearing the mask are vaccinators.
I so your focus is more on the vaccinators.
Yeah. I'm
So
focusing the more on the vaccinators.
your objective is to have 100% of your vaccinators to be safe, which means wearing mask. That's
Yeah.
your
Because
view.
if they are wearing mask, they are safe. Also, they are not spreading if the virus for the others. Yeah. These
Okay.
are
That,
keeping the okay. How about you?
that's what that would be not very good. You're becoming far more specific. My second issue is related to the delivery of those equipment, because to get you have one activity which is to deliver the equipment. And what is, do you face challenge in delivering the equipment, or have you already detailed how you make sure that every group of vaccinator receives the equipment and know how to wear the mask, for example? Have you already planned, or for the time being, it's a generic idea, not
We are
worked out?
planning the campaign to conduct it for in September 16. So we are starting now to deliver and face masks to
Okay, so I think it will be important
all
in
the
your project.
sectors. Yeah,
They,
we will
they,
ensure that all.
yeah, but you need, you know, when you want to ensure an all, there are some critical steps. Are you aware exactly how many masks you need? Are they available? Do you need to do something to make sure they are available in sufficient quantity or not? You know, when you want to deliver, there are some steps to take to get them delivered, but that will come maybe over time in your project when you are planning. But you need to be sure that you have the action step to make sure that every unit of vaccinator receives sufficient number of masks.
Yeah. I have already started the micro plan of
Good.
per districts and logistic plan. So we will ensure the number of vaccinators and number of face masks that they need. Yeah,
I
over to you.
So it will be very important for you to detail in your form all those action you're taking to make sure that the masks are received in sufficient quantity at every unit, and maybe that they are trained to wear them. So that will be important in your project to go in that level of detail. And the last one was on your supportive supervision. I think you say you're going to have supportive supervision. What do you expect those supervisors to do? How are you going to make those supportive supervision work in practice?
Yeah. We first there is a supportive supervision plan. So we will send each district a supervisor. He will supervise how our vaccinators they are implementing these and preventive measures while they are doing house-to-house activities. So they will use a form and through the ODK, which they are during their monitoring, or they are meeting with a vaccinated teams. So we will also do a plan how to conduct a supportive supervision. Yeah.
I think thank you for clarifying. So you just clarified that you are developing a form for the supervisors with indicators to observe, and you are saying that they will monitor the implementation of your activities to make. Well, I hope you will have some indicators you could share, but I think those details are very important in your project to be extremely clear. So going beyond the just supportive supervision, but going into the action step you need to make supportive supervision effective. Thank you
Okay,
very much.
thanks.
Okay, thank you very much, Yusuf, and thank you to Francois. I think those in the room, they have learned a lot from that exchange, because that is the whole essence of it, and that the guidance Yusuf, you have received from Francois Gaz will be helpful to you while you draw up your project. All right, okay, so
thanks.
thank you very much. Now, I've been seeing comments coming up on the chat about if the ideas that were posted on the ideas engine can be used for the project. The answer is a definite yes. So the same idea that you proposed in the ideas engine, you can develop it now to your project, but also make sure you can also use other ideas from Scholar in the same line to enrich your own, to enrich the actions that you're going to take. So that is not a problem. And then there is a question from Tahami Rabiu. Please, I need more explanation about this project. How are we going to send it after we finish? There is a whole procedure. I'll advise you to go to learning.foundation. And then there were the links that I shared on the chat. I'm just going to share those links again that I shared on the chat on where you go to get the rubric. That's the guidance for this for this project. I'm pasting it again here on the chat, so I'll just direct you to those. And if you have any trouble with that, I advise you to join the technical support session tomorrow with Alain Blaise at 11 a.m. Geneva time. There you could get very useful support. Now there is Sabitu Sanusi. You asked a question in the chat that I don't really understand. You say, I'm Sabitu Sanusi from Nigeria, asking how to conduct the project for those that have an Android system. So I don't really understand what you want to share. So if you want to throw more light on that, you can raise your hand, and then we'll be delighted to invite you to unmute yourself. So we are going to take one other presenter for today. Owusu Kwadwo, your hand has been raised for quite a while now. So I'll invite you to unmute yourself. I would like to hear your idea. What do you have to share, please? Your answers to the question. So you start by telling us where you're joining from, and then you answer the questions.
My name is Owusu Kwadwo. I'm joining from Ghana, West Africa. My submission to the first question, the priority challenge. The priority challenge that we are having in the region, in the province at the moment is we don't have enough PPEs, personal protective equipment, and then also non-adherence to the infection prevention protocols, and then the social distancing at some of the immunization sessions. So that is a major challenge. It's a major challenge that we are facing. And second question, the goals, if these measures are put in place, enough PPEs and then adherence to the infection prevention protocols like hand washing and the wearing of the personal protective equipment, it will reduce the spread of the COVID-19. And then the second question is, the third one, the last one, the specific actions. We don't have the PPEs, we have them, but it's inadequate or it's insufficient at the various immunization sessions. So we will engage opinion leaders at the various levels, and then also we appeal to philanthropic organizations like churches and other religious bodies to also contribute in the provision of personal protective equipment. And then also lobbying with the Ministry of Health and then the MOH, to provide us with enough PPEs. And then also training for staffs. The training, they have it. They have a lot of trainings have been organized for the sub-district or those at the various immunization sessions on IPC, but they still need training. They still need training on the infection prevention protocols in order to address these challenges identified in the region.
All right, so thank you very much, Owusu. I have a question for you. I want to find out, have you evaluated, like you said, have you evaluated the training needs? Earlier on when Francois was talking to Yusuf, he said specifically what objective, what is your target? You know, is it all, have you been able to access the need in training or even the need in PPEs, you know, to be able to have specific actions that will, you know, enable you to.
Yes, I've been able to assess it. Yes, because I'm at the district level. So when we receive the PPEs, we distribute it to the various immunization sessions and the various facilities. So we realize that the personal protective equipment are inadequate for that one. And then concerning the training needs, we organize periodic and regular training for staffs, or not only on infection prevention, but in other areas. So there's a gap or there's a challenge in the area of the infection prevention and then control.
Okay, so thank you very much, Owusu. Francois, what are your thoughts and any more additional questions concerning Owusu's response to the questions?
I think I would say that Yusuf present a general challenge, which he said, I think his challenge were more like, if I'm not wrong and I've understood well, is that the infection prevention approach is not enough focus on the needs of COVID. And he has a problem with he has, of course, there is a delivery of equipment to protect the vaccinators, to have hand sanitizer, but he said there is not enough. So I would like to, this is quite a big challenge. If you want, you need equipment and you don't have enough, it's an important challenge. When you have enough, the next challenge becomes making sure people understand why and how to wear them. But could you explain what is the reasons why you don't have enough? What's the cause of the challenge of the insufficient number of equipment? What percentage are you covering, and how are you going to achieve a higher coverage with your needs?
Thank you, Francois. And I'll just add to that question with a question from Obed Philip Niobe from Ghana too in the chat that is linked with yours. He says, thank you, Owusu. How many PPEs do you need now? What percentage have you received so far? That's talking about the gap. So please, Owusu, can you go ahead?
Now, with concerning PPEs, right now, we've received 60% of PPEs. And then we need additional 40%. And with the PPEs, that one, in addition to that, with the hand washing equipment, like we talk about the hand sanitizers, and then the, what do you call it? The tissues. They are all inadequate. We get them, but we use them, and then it gets finished.
Thank you. It's a very, I think that become a very concrete, now you have specified exactly your challenge. And for me, just this is a huge challenge to undertake. And I'm not sure how you're going to cover going from 60% to 40%. Why did you receive only 60%? Was it not enough? Because now you end
Yeah,
up in stock out. What was the problem behind the 60% not covering your needs? And how you going, what's your challenge to get 40%? How can you get there?
That one, the PPEs are being supplied at the national level. So they supplied it. So what we receive is inadequate. So right now, to cover the remaining 40%, like I earlier mentioned about it in my earlier submission, we are still engaging with the opinion leaders at the various levels. And then we are also appealing to philanthropic organizations like the churches and then the religious bodies and other concerned individuals to come to our aid so that we can cover the remaining 40%.
You know, thank you very much, because now you have a very specific challenge in front of you that will be very good for your project. We receive only 60%. Why is it a challenge to get the last 40%? Get to the cause. It's a priority issue if you want to ensure safety of your vaccinators. So it's a very good challenge now. You have even monitor, and you would like to have 100% equipment. And it will be important to list your ideas that you need to implement in order to report that in your district, in 2 months' time, with a timeline, you will have the 40% you missed. That will be extremely, or the hand sanitizer that you mix, this is important. This is one challenge, and you have mentioned a second challenge, which is a better training, more focus on the needs. Now you can choose one challenge or both of them, that's up to you. But then you will have to do the same to be very specific on what's missing in the training and how you're going to improve it in practice in your district. Thank you.
Okay, thank you very much, Francois. I just wanted to, one more question, Owusu. How has that impacted immunization services and the immunization coverage? Have they been suspended in some places because vaccinators don't have PPE?
They have, but just that it's inadequate. That's what I've already said. It's insufficient. It has impacted on immunization in some way. Professionals don't have the PPEs. Sometimes they feel unwilling to go to the field to do the necessary work that they are supposed to do. But notwithstanding that, we are still making progress in the immunization performances.
Okay, thank you for sharing your experience with us and for attempting answers to those questions. There is a question here from Mercy Ono Peters that says, has this issue been discussed in your meeting or has it reached national? And what is the feedback from the national for successful vaccination? So it's like your presentation also has gotten a lot of reaction. We are seeing on the chat and even on the Q&A. So that's a question from Mercy Onu Peters from Nigeria. That have you seized the national level? Have you informed them of the situation and what was the feedback that you obtained?
Yeah, national level is aware. They are even aware that we don't have inadequate personal protective equipment, but still nothing has been done about it. We've sent reminders to them to national level for the provision of adequate personal protective equipment for our health professionals. But still nothing has been done about it.
All right. Thank you once again. So we are 9 minutes over the 30-minute mark that we set for this session, and we already do apologize for going over time. There is a question on the Q&A that I would like to turn to Francois for a response. It's from Josephine Owusu Yeboah that says, please, I would like to know the difference between summarizing the immunization COVID situation and the main challenge you will work on.
I think it's an important, you know, when you address a problem, you have the overall problems. And this was raised by one participant, and it's a good way to start. And to say, in my district, in my health center, the coverage has dropped down, the Penta 1 or the Penta 3 or measles has dropped by 80% of the dropout since COVID. It's important. The second is for you to go to what are the causes, and that become your sub-challenge, where you say the cause is that maybe mothers are not coming to the health facility because they fear to be infected by the staff. This is, now you will have to say this is a priority, then becomes to address, to make sure that the staff is covered and does not produce a risk for infecting the mother. And then to get that, you get to your next challenge. I need equipment. And then this become your top priority challenge, is to look at, you have 60%, you can describe very quantifiably what you're missing. You can define, except in the cause that the government is silent on your request, only gave you 60%. And the next is that you have an objective now is to get 100% and to get the 40%. And I'm sure it's not a simple objective. Maybe it's easy, I don't know, but I see it as a complicated challenge that you have taken as your challenge, and it's a valid one. Now you will have to describe what are the action steps you have to do, 1, 2, 3, 4, 5, to ensure that you get the 40% missing. So this is kind of a logic of describing your challenge and coming at the end with action and action step to address that specific challenge. Just this itself is enough in your project to be justified. You can, of course, describe at the beginning a certain number of challenges, but if you choose one challenge to address, it's because it carries a big weight on the non-attendance by the mothers, and you've decided to tackle this one specifically and resolve it. Am I clear?
I think you're quite clear, Francois, and I want to really thank Josephine for asking that question, because I think it was quite pertinent. And I see Farouk Umar Ismail said on the chat, provision of PPEs, in my opinion, is the challenge unless you have adequate funding. Adhere to IPC protocols by the healthcare workers could also be another challenge. It means that the PPE could be available, but the healthcare workers don't apply the IPC protocols. And yeah, so I think Owusu in his presentation addressed both. You know, I think the training aspect was to address the respect of IPC protocols, and then acquiring the PPE was also another aspect. And then there is Ruth Boatema that says we can also manufacture our own locally made PPEs. So that could also, Francois, that could be an action, right? But we will need some more detail because it has to do with, yes, Francois, go ahead.
Absolutely. I think it makes sense. If you can, you will need in practice to address those two challenges. Getting the adequate number of protective equipment, and the second, training people in doing it. And of course, when you want adequate equipment, maybe one of your action, it was mentioned, is one idea, which is to have them made locally. If it's in line with the Ministry of Health recommendation, I think it's a very good solution that may be easier than getting the funding or next supply from the government. I'm sure you're not the only one district facing this problem. If there was an equitable distribution, maybe some district populated didn't get the benefit or are more affected than the small ones. I don't know how was the distribution made, but this is a solution. And then the training is important. Having the equipment and nobody trained, you may have women, mothers saying, but this guy is not wearing the mask properly. I don't know how educated they are on that, but it could be an issue if they are misusing the mask. And of course, addressing those two in your project is totally acceptable. And the action to solve those two problems need to be very clear. Thank you very much.
Okay, so thank you very much, Francois. And I think this is a good way for us to end our session today. We added 15 minutes to the regular 30-minute session. And we do apologize for that. And if your hand was raised today and we're not able to give you the chance to talk, we do apologize for that too. But we know you're all busy professionals. For some people, it's still early on in the day and they have to get back to work. For others, it's getting towards the end of their day and they need their rest. So we'll just say that we should make it a date tomorrow while it's 6 p.m. Geneva time, and we'll be delighted to get to talk more about the projects, about your challenges, about the actions that you are taking or are going to undertake to overcome these challenges that you're facing. I'd like to thank Promise Onaibe, and unfortunately we have not been able to take you again. We do hope we can take you tomorrow. I'd like to thank Yusuf Mahmoud Elmer from Somalia, and I also want to thank Owusu Kwadio from Ghana for sharing with us today. Look forward to seeing you tomorrow at 6 p.m. Geneva time. Until then, stay safe. Bye for now.
Thank you. Goodbye.